Hi everybody, Christine here. I am 3 days post-op and I just felt okay enough to be able to do this. So I had my legs worked on, this time the front of my legs, not the back. You have to keep them up, and this video is going to kind of be a lot towards the ladies who are a little hesitant on having the surgery. I will say, it's not that it doesn't hurt, because it does. It's quite painful, but it's the pain comes from nerves reattaching and all that good stuff. I'm sure it comes from inflammation too. What I'm doing is these are the what are they called? Oh, I forgot. Drains. Thank you, my husband whispered it to me. These are the drains. You have two on the top and two on the bottom. And as you can see right now, there's not a lot in it, in any of them. I did just do the stripping. You do the stripping by squeezing and going down, and it just helps it come through. I don't want to do it right now, because when you get to the end of where it's draining, it kind of burns inside, and so I don't want to do that on camera. Anyway, I just attach it to my shirt. There's two on the top, two on the bottom. My shirt is long enough that I have all four attached here. They get in the way, and you have to kind of remind yourself that they're there, because who thinks of it? And so the best thing to do is to get up and walk around, and I'm getting ready to do that now. But I will say that I have gotten the best sleep, and it's like a rejuvenating sleep. I don't sleep very well for multiple reasons. Those of you that have lipedema and Durkheim's, you know how your sleep habits, how they are. Lucky to get a couple hours of a night of sleep. The night before I came here, I was, anxious and excited, so I got 18 minutes of sleep, and then 20 minutes on the plane. So by the time I got here, I was pretty tired, and I think all I've done here so far is sleep. So in those areas, I feel great. It clears your mind. It's interesting how sleep really does help. Anyway, so I just want to say that the pain is there, but compared to what we go through every day, it's nothing. This, that there's a light at the end of the tunnel, and it's only going to be this painful for this amount of time, and then it's gone. I can tell you that my bottom part of my legs, the day after your surgery with Dr. Schwartz, you go in and they take off your garment, and you see your legs, and they're swollen, yeah. But they took off half my calves, and for the first time and I don't know how many years, I ran my finger over my shin. And normally, when I would do that, just a light touch would hurt. And I was able to do that. And I felt no pain for the first time. And I don't know how long. So if anybody asks me, is it worth it? I will say a resounding yes. And if this is any indication of what my life will be after as many surgeries as it's going to take, I have no doubt that I'll be able to get out of bed and take a shower and get out of bed without my first thought being, okay, analyze. What are you going to be able to do today? And you get up and you go to the bathroom and you look at the shower and you say, that's going to be an hour. No, can't do it. And that's how I've lived my life for the past, maybe 5 years at least. That's when it had gotten so bad. And to go from bedridden to be able to live, play with my granddaughters, what a, I don't know, you don't want to get too excited because you don't want to get let down. But Dr. Jaime Schwartz he's out here in Beverly Hills, and he cares. He really cares. And basically he had said, I'm just going to keep going as long as it's safe. I just want to get all of it out. And I won't know the extent of what he did until Monday. But my calves are doing great. And yeah. There's a lot to look forward to. And this is step one. Anyway, oh, and remember to ask them to take the crotch out of your compression garments, because at the first day that I had them on, taking them up and down is horrible, because you take them down and it squishes in. So if you have this stuff in your legs, I'm bruised from here to here on the outside of my thighs, and I have some bruising on the inside. And every time you take them down to use the restroom, it would dig in, it's compression. So it would dig in, and then it would be difficult to get them back up. And but second time I asked them to take the crotch out, and going to the restroom is much easier. So I'm just going to show you day 3. They tell you to walk, and walking, well, see, right now it's all pulling right in here and in here. And it's okay, because it's temporary. So, now mind you, this is only my experience. Everybody's experience is different, because everybody gets a different level of care. No two people are the same. But this is my experience. Okay, so I just kind of get to the edge of the bed and use things to help me get up. You know, use the dresser, nightstand, and the bed. And I've got a horrible back, so you might be able to do this a lot easier than me. But at first, when you get up and I don't know if it's all the blood that goes down to your legs now or what, but it hurts when you first get up, and it lessens as you walk. So I just take it slow at first. I mean, I have a upright walker that I use, and mainly for my back and whatnot. But when you're walking, the pain seems to dissipate. So definitely walk, because it helps everything move, and it'll help everything, it just helps it all move, and then it'll come out in the dreams. So, yeah. So my husband is here with me, and he does a lot. I'm very much a self-reliant person and don't like to ask for help. He's very proactive and no doubt bored because I've been sleeping a lot and we can't play the games. We brought games to play together and I'm out of it most of the time, which I love. But this is what he's done. He's smart enough to bring a puzzle to keep himself occupied. Funny enough, it's California Dreams. So, he keeps himself busy doing the puzzle while I'm kind of out of it. And we brought some of our other favorite games that hopefully today and beyond we'll be able to play. I don't walk a lot, but I probably should. Oh, and we're in this nice Airbnb. It's over by UCLA. Got a little patio and stuff, and it's got everything that you need. So if you want to stay here, let me know, and I can give you that. But yeah, so the walking will help. See, I'm like getting faster. Eventually I end up right back here, and sitting is not great. You feel the pain going up in your legs, and when you get it back in, you gotta kind of be aware of where your drains are, and use the bed to help you, and then you're right back to where you started. And then you just take the drains and put them back down, connect them to, I use the pillowcase. It just needs to be on a downward motion to help with the gravity. I'm getting tangled. The two on my shirt for the top, I just let it hang from wherever I put it. And if you strip the drains, it allows it to suck up some more. So kind of gross, but it helps it a lot. So definitely do your drains. Yeah, and that's it. Okay, well, I'll talk to you on Monday when I get these things off, and I'll see you then. Take care.